Hi. I'm Cedric. I'll be your nurse for today. How are you doing today?
Okay, how about you?
Good, alright. Can you verify me your date of birth and your full name?
Sophia Below, 6/13/1993.
Alright, thank you, Sophia. So I'm here to teach you about your new prescribed medication. It's Atenolol Tenormin. Alright. Before we start, a few questions. Are you pregnant, breastfeeding, or anything at the moment?
No.
Do you have any allergies?
No.
Any medical conditions that I should know about?
No.
So Tenormin, you're gonna take this on the daily. It's a 50 milligram tablet, and you want to take it same time every day, and you must take your pulse before you take it. Okay. And towards the end, we're gonna teach you how to take your pulse properly. Okay. Alright, so this drug works by slowing down your heart rate, and it's going to make it easier for your heart to pump blood throughout your body. It's a beta blocker, which means it's going to affect
Beta blocker will affect the heart and circulation by decreasing the blood pressure and the heart rate.
Used to treat your high blood pressure or your hypertension.
Okay.
Alright, common side effects. It's going to make you feel tired, weak, cause of erectile dysfunction, and depressed mood. You might want to change your position slowly when you're doing your activities, and you don't want to drive with this medication, okay? Until you know how it's going to affect you and how you feel about it, then you can go resume your normal activities. So it's going to be your first dose. You want to take this on the evening because it's going to make you feel dizzy. And you don't want to skip or double dose on missed dose. Take missed dose as soon as possible, up to 8 hours before next dose. And you have any questions?
Not at the moment.
Alright. How's your diet?
I would say pretty well. I like to eat a lot of vegetables. I work out 3 times a week at least. And sometimes on the weekend I eat a little bit more than I should, but I think overall it's okay.
Oh, that's really good. And do you drink alcohol?
Sometimes here and there.
Alright. So this drug, you want to decrease the alcohol use. You can still drink in moderation, and you should definitely contact your healthcare provider so you can tell you how much you could drink. And let's go over some serious side effects when you want to call the provider, okay? So if you have 60 beats per minute or less, that's when you want to...
You must hold the next dose if your pulse rate is less than 60 beats per minute, and you must notify your healthcare provider.
Chest pain, lightheadedness, feeling of passing out, severe drowsiness, shortness of breath, rapid weight gain, or swelling on the legs, and most importantly, if you suspected that you're pregnant, let your provider know.
Okay.
Alright. Any questions?
Not at the moment.
Okay. Definitely don't suddenly stop taking Atenolol if you're feeling better, okay? Because stopping it's gonna cause a rebound hypertension.
Rebound excitation may occur if this medication is abruptly
Your blood
stopped.
pressure will just go up after you start taking that. And if you need to discontinue and you speak that to your provider, you're gonna taper off over a week or 2 on this medication. Okay? Alright, so let's go over how to take your pulse. Let me see your hand. So you take your middle finger and your index finger. You're gonna place it under your thumb. You feel tapping or pulsing?
Yes.
Alright, so you're gonna count how many pulses you're tapping for a full minute. You can use your clock, you can use a timer.
Okay.
Alright. And I have your hand out right here. highlight most of the stuff that's important to know. You
Okay.
can read the rest of it. And here's your medication.
Okay. Thank you.
Alright. So just call the doctor or maybe ask the pharmacist. They're very knowledgeable if you want to know more about the drug, okay?
Okay.
Thank you so much.
Yo por ti, tú por mí, yo por ti, tú por mí, yo por ti, tú por mí. Yo por ti.